I'd like to have a more in-depth discussion about bipolar disorder. What is bipolar disorder? Bipolar disorder, also known commonly as manic depressive illness. What does that mean? What does manic mean? And I'm talking to my patients right now, and if you see me in the office, you're now in another room watching this video, and you're going to be learning about what bipolar disorder is. What is manic illness? We're going to go through some generalities of what manic means. It's an energized state. One of the most common things people say is that you're like high, you're happy. Well, that's one part of it, but another part is an irritable, an angry part. The manic individual, you can pick out easily in a crowd. They're talking loudly. They get too close to people. They invade your personal space. Their thoughts race. These are the individuals who have a lot of grandiose ideas and an inflated sense of self, and they're going to go buy a hotel or buy a G5 Gulfstream jet. Nothing ever happens. They can't concentrate, but they do have great ideas. And that individual likes this state. That's more important later, but I'll talk about that in a few minutes. They like being manic. They don't sleep, they're energized, they're inflated, they're grandiose. Another problem that we need to get into with the bipolar patient in a manic state, they scare people off. To be around someone who's bipolar, they're inappropriately angry, intimidating, aggressive, hostile. They may become violent. A little side story about this violence. I worked in Coney Island on a mobile crisis team, going out to see people who were mentally ill as a psychiatrist in Coney Island, New York. The most dangerous patient out that we would see, I did this for 2 years, was a manic patient. This is the most violent, dangerous, unpredictable individual you could have. This mental illness makes that individual the most dangerous. When the worst things would happen, it was usually someone in a manic state. What else can these individuals have? Poor judgment, poor social judgment, poor spending decisions. I may have someone go out and buy 3 pairs of ostrich skin boots for $2,000 a piece. Buy an excessive amount of things that they really don't need. Reckless eating, binge eating on foods that are very fattening, excessively. Poor temper control, impaired decision, giving away money, driving recklessly. I had someone, Andrew, recently. He was driving down 95 here in Florida, probably going over 110 miles an hour in his BMW, weaving in and out of traffic on 95. They're very distractible people. What are the biggest problems with these individuals? They're not sleeping. They're aggressive, they're irritable. Now how is that going to work in the workplace? I had one who's an engineer. The economy is not going that well right now, and he mounts off to his boss about nothing, in a very flippant, irritable, curt, short, obnoxious way. He's like, well, that doesn't make sense. He was right, but that's not a good political way to deal with something. So manic people turn people off. They sabotage relationships. Their ideas they can't follow through. People tend to get away from them. And their impulse control is poor, so they may have inappropriate sex with people. They may eat the wrong food, spend the wrong money. They're really not that fun to be around. And they're damaging to themselves. I'm going to get more into the long-term effects of bipolar disorder in a minute. I've described a little bit what the manic is. What's the depressive side? And these people cycle. They don't have to. But in most cases, the manic periods are followed by periods of depression. What exactly is depression? You hear a lot about it. A lot of people are depressed, but to be clinically depressed is a little different. Just as in manic illness, those symptoms interfere with all aspects of your life. Well, so does the depression. The most common aspect of depression is to feel sad, down, blue. And this sadness is much more extreme than just, I lost my job sad. It's, I can't function for more than 2 weeks sad. Hopeless, helpless, guilt-ridden, thoughts of death, thoughts of dying, sense of despair, ruminations about death and dying and guilt. These individuals are different than just someone who's having a bad day. They may spend weeks in bed, not shower, neglect themselves. I had one individual who just drank Orange Crush and ate black licorice for months on end and sat in his bed in his pants from Target with the elastic band around it and the same t-shirt, unshaven, uncleaned, eating the same thing with the windows closed, not leaving his house. I mean, eventually his family came in and got him to the office, and I was able to help him out. But we're talking about extreme states here. These illnesses, both manic and depression, can lead to the ultimate side effect, which is suicidality. People wind up killing themselves. The manic state may progress in an individual who starts hearing voices, seeing things, becomes delusional. This can also happen in the depression state when it becomes severe. People may become psychotic, hear voices, see things, become delusional. What are the types of bipolar illness? I've talked about what manic is, I've talked about what depression is, and those are two opposite sides of the pole. That's why they call it bipolar. What are the types? The most severe type of all the types is bipolar type 1. That is where the individual may be so impaired by either depression or bipolar that they really need to be in a hospital. That individual may become psychotic, suicidal, or so dangerous to the people around them, they need to be hospitalized or they need to be protected from themselves. That is not the most common. The most common type, I would say, is bipolar type 2. You may have experienced that in the work environment or with a family member. Someone who's a little bit irritable, a little bit too aggressive, intrusive, mouths off too much. Someone who's having a relationship with is unpredictable. You never know what they're going to get. Whether they're so depressed they really don't want to talk, or they're just bite your head off, or they're making poor decisions. But it's not so extreme. They're not a threat to themselves or anyone else, but they do self-sabotage in bipolar type 2. These individuals have difficulty maintaining jobs, maintaining relationships. They have difficulty following diets, or their impulse control with alcohol and drugs is not there. And they constantly are having to start over because they drank, they used a drug, they ate the wrong foods, they spent too much money, they lost a job, they lost a girlfriend. There's another type called rapid cycling. If you cycle more than 4 times in a year between manic and depression, that's considered rapid cycling. Most people 1, 2, 3 times a year go between manic episodes lasting anywhere from usually 4 days to weeks, where depression periods may last 2 weeks to months. But usually the cycles only happen 2 or 3 times a year. If it's more than 4, it's considered rapid cycling. Now, there are different states here. There's called the bipolar disorder mixed, where someone could be going from a manic to a depressive state within minutes or seconds, or having both manic and depressive symptoms at once. There is another type of illness. It's called cyclothymia. That is where you have not even a hypomanic, which is a low-level manic, but a very mild form of mania and a very mild form of depression. And you cycle very slowly between these mild forms. So I've talked about 4 forms of the bipolar disorder. The most severe is bipolar type 1. The most common is bipolar type 2. And then I talked about the mixed state, the rapid cycling state, and cyclothymia. I guess that's 5. I get questions with this. Are there tests for this, doctor? And no, there's not tests. The diagnosis is made by history. It's good if you're going to a psychiatrist and you're worried you may be bipolar, bring a family member, bring a girlfriend or a boyfriend. Bring a significant other in your life. Because the history is a psychiatric interview. And through interview, the psychiatrist or the mental health professional you're seeing will say, yes, from your history and from the symptoms you're describing over the time period you're describing, I can see that you're having a mood problem. And this mood problem is called bipolar disorder. And they may or may not choose to tell you the exact nomenclature or type. I don't think it's necessary for people to know exactly because it's kind of meaningless. You have mood swings, you want to correct them. I think that's what you need to know. Another question I get is, what causes this? The number one cause of this is probably genetic. You're born with it. But there are things that can cause it. The biggest one is stress in your life. Going to college, losing a loved one, a death, a loss of a job, financial stressors. Currently right now, people, their house is being foreclosed on. And they tell me, yeah, I became manic and disorganized. So stress is the number one reason I would say triggers off a manic or depressive episode. Another one is decreased sleep. If you keep someone who has bipolar disorder, or even someone who doesn't, you keep them awake long enough, they will start exhibiting mood swings, manic and depressive symptoms. A big one is drugs. If you drink alcohol, use cocaine, use amphetamines, you use over-the-counter diet pills or stimulants, you smoke marijuana, you use amphetamines, that will cause bipolar mood swings. Even opiates, benzos like Ativan and Xanax, just being intoxicated on these drugs and then stopping them may induce a manic state. What age is the most common for this to happen? Usually from 15 to 25. It happens in equally in men and women. People say to me, I get this question a lot, I say, well, why should I treat this? Well, here's a big news alert. Untreated, this illness is neurotoxic, meaning the manic and depressive states do actual brain damage and do permanent brain damage. So that individual, their cognition or their mental state or the fluidity in their thoughts, calculations, cognition, speech slows down over time. So untreated, after 30, 40 years of this, you start developing signs and symptoms of dementia, which is decreased cognitions or decreased intellectual functioning. So it really needs to be treated. That's on a physiological level, sort of that's your body, how it will damage your body. But the long-term side effects, even more so, are social. If you become manic and keep losing jobs and having to keep start over, keep getting yourself into debt, having to keep start over, getting in accidents with your car, have to start over with the car payments, you lose relationships, these are devastating. If you think about it, relationships last lifetimes, and if you're with someone for years and then because of a manic episode you did something terrible, hurt them, threaten them, steal, lie, cheat, or do something horrible you would never normally do in a manic state, that relationship will end. Let's say you cheated on them because your impulse control wasn't good. So the real impact is biological, hurting your body, but also socially hurting yourself. Those could even be more devastating, and those occur much earlier than the physical problems. So what can I do about this? And what do I tell patients? And I hope some of my patients are watching this video. The key here, I would say, is what I tell people. Listen, we need to live a low-stress life. Okay, that may not always be possible. Let's eat the right foods and let's exercise every day. Let's not use substances of abuse. Let's not use sleeping pills. Let's not drink, use cocaine. Clearly, those will cause the illness to present itself. Here's another big one. Go to sleep at the same time every night and wake up at the same time every morning. So lead a low-stress life. Watch careful what you eat. Binging on sugar could also stimulate mood swings. Eating the wrong foods. Let's eat healthy. Let's exercise every day. And let's not use drugs of abuse. And let's go to bed at the same time every day and regulate our sleep cycle. What does the treatment involve? So patients ask me, is this the end for me? No. You may have this illness untreated. This is really bad. But yes, we can treat this very effectively. And I would say virtually all my bipolar patients in this practice are working or living normal lives. So is there any effect? If you don't treat yourself and you do everything wrong, which a lot of people do, they don't take their medication, they don't go to bed at the same time, they use drugs and alcohol, they lead stressful lives, yeah, you're going to have problems. What can I do about this? The treatment. Treatment involves, as I said, sleep hygiene, food, nutrition, exercise, keeping a low-stress life. It may involve a therapist. The therapist will help you gain insight into illness, to recognize when the illness is affecting your life, and you need to develop an action plan. What do I do when I become manic depressed? Call my mother, call my doctor, get evaluated for medication change, tell my therapist, tell my wife, and make sure I do the appropriate things needed to help myself. So recognizing illness, how to deal with illness, develop better coping skills with your therapist. Usually therapy is once a week. A key feature of this illness is taking medication. Now someone comes into my office and says, doctor, I'm having these symptoms. I've never needed to be in the hospital. I've never gotten psychotic. I just am irritable, angry, very frustrated, temper tantrums, rageaholic. People are afraid to be around me. My boyfriend never knows what I'm going to get. I could be raging in his face, screaming for really little provocation. I cheated on him, or I hurt him or her. I binge eat. I'm impulsive with drugs. Yeah, well, maybe that individual is bipolar type 2. Hypomanic, cycles to these depressed periods, which aren't that severe, maybe last 2 to 3 weeks. They're not severe in length of time, but the symptoms may impair that individual. What do you do? Well, I say to them, the most common thing I do, if I see that there's these manic periods that aren't severe, I say, my first treatment usually involves a mood stabilizer. What are the most common mood stabilizers? Well, the most common, the most widely known one is lithium. I'll give you the names first. There's lithium, Depakote, Lamictal, Topamax, and Zonogram. Now, which one do you use? Lithium. Lithium is a great drug. It's actually an element found naturally occurring in nature. It will control the illness. It will stabilize people with bipolar disorders, bipolar type 2 in the case I'm describing. What's the good and bad of lithium? Lithium works. It's a pill that you take. It comes in different forms, lithium carbonate, lithium citrate, very identical. What's the good? It takes about 10 days being on lithium. You need to have a certain level of lithium for it to work. Once the level is reached, within about 10 days, that individual's mood symptoms will stabilize. It can also help depression. Why don't I use lithium, and why is lithium falling out of favor? Here's what I don't like about lithium, and if you're on it, don't panic. Do not stop your medicine because you saw this video. It's something you change over months. Don't just stop it. That would be reckless. But lithium, the reason I avoid it, lithium may put on weight, cause water retention, cause a fine tremor of your hands like this. Lithium may interfere with thyroid function and cause the thyroid to stop working. Lithium may cause kidney problems and cause interstitial nephritis. Lithium is associated with acne. Lithium has a narrow therapeutic window, meaning if you take too much, you die. It interacts with alcohol and medicines like Advil, Motrin, ibuprofen to become toxic. When toxic, lithium can make you very sick. Nausea, vomiting, diarrhea, tremor, delirium, and death. Because of these side effects, and lithium has caused mental slowing. I don't use lithium first line. Is it still something that can be used? Yes. Is it something I choose to use first? No. Depakote. Depakote is an anti-seizure which also can be used in lithium. And also could be used in bipolar disorder. Depakote works in 7 to 10 days. I think it's tolerated better than lithium. It is an anti-seizure medicine developed early for seizures and later on used for mood swings. Depakote works well, but it may cause drowsiness, weight gain, hair loss. It also has therapeutic levels. It may have effects on the liver. Good drug, better than lithium, I would say. But is it the best thing out there? No. If you're on it, don't stop taking it. It may work for you. And if it is working for you, I would stick with it. But you have to do lab work like lithium periodically. You have to check the levels and your liver function. But it does work well, but the drowsiness, the hair loss, and the weight gain are something which prevent me from using it first line. Lamictal. I like this drug for the following reasons. It is tolerated very well, without weight gain, without mental slowing, without risk of overdose or minimal risk of overdose, without a withdrawal syndrome, without drowsiness. It has its problems though. Nothing's perfect. I like lithium. I like Lamictal because it has antidepressant effects. It'll stop the manic episodes. Lamictal has its problems in terms of the rash. The rash with Lamictal in 0.08% of cases could be fatal. If you're watching this video, don't stop Lamictal because you think, I may get the rash. The rash usually occurs around your face or neck in the first month, usually in the first 1 to 2 months of treatment. It can occur earlier. It's not really a rash, it's a rash of your skin, but underneath the skin is an autoimmune problem occurring, and this could be fatal in 0.08% of cases, which is very low, which is one reason the dose of Lamictal needs to be built up over 5 to 6 weeks, very slowly. And the patients need to be educated. If you get a rash on Lamictal, usually on your face, or your neck, or your face, stop the drug and call your doctor immediately. I've seen it happen twice, and I'm not sure if it's the fatal autoimmune rash, but both those patients are fine. But it has been reported to be deadly. The rash usually occurred earlier on when the drug was used in very high doses. Now we use the drug titrated up over 4 to 6 weeks. Other drugs like Topamax can be used, another anti-seizure. Topamax can work. I'm not saying it's as effective as lithium Depakote or Lamictal, but it can be effective. The problems with Topamax? Well, one, for the women out there, it interferes with birth control pills. For everyone, it interferes with cognitions. Your brain doesn't work as well. You get a little slow. You get forgetful. You can't calculate as well. With Topamax, Topamax has advantages because it prevents migraines. The disadvantages of Topamax with this mental slowing, the birth control pill problem, but the advantages are you can lose weight on Topamax. So it can stabilize. It has its good and its bad. I've used Zonegran, which is another anti-seizure. I've had some side effects, GI, headache side effects. It can affect electrolytes in your body like sodium, and that can cause problems, i.e. seizures. Does it work as well as the others? Probably not. So that probably is a last line of defense. Neurontin, I've heard people use it. That drug, I would say, does not work well. Some people have tried Lyrica. I would not use that for the treatment of bipolar disorder. Now, these were mood stabilizers I just talked about, that class of drugs. Then the next class are the antipsychotics used in the treatment of mood stabilization. Just because these mood stabilizers are called mood stabilizers doesn't mean other drugs don't stabilize mood and work just as effectively. The atypical antipsychotics are now being used to treat bipolar and have so for a while. I'll run through the list. Abilify, Geodon, Zyprexa, Seroquel, Clozaril, Risperdal, and Invega. These drugs as a class are called atypical antipsychotics, and that class is usually described by how they affect the brain. They all block dopamine, and that's a neurotransmitter in the brain. I don't think that's that important to know. It's simply these drugs share characteristics of side effects mostly. 0.4% of people who take these drugs may develop a permanent tic of some part of their body. That's a repetitive movement. It's rare. They may have an increased risk of diabetes or stroke. Some of them may put on weight. I'll briefly go through them, but Abilify would come top of my list in this class. It has the least weight gain, the least drowsiness, and it has the most effect on your mood. Geodon can be used, may cause some drowsiness, weight gain, but is effective in treating bipolar. Zyprexa, another great drug, but it may put on weight, which predisposes people to diabetes, a metabolic syndrome. That's problems when the internal workings of your body start experiencing elevations in triglycerides, cholesterol, and high sugar levels and insulin. Seroquel is another good drug. It may put on weight, cause people to binge eat at night, but it helps people sleep and can be very effective in bipolar. I mean, your doctor may use combinations of these atypical antipsychotics and the mood stabilizers. The combinations are what's key, and it's not so much the best drug, it's what works is what you want to use. Just because something is the best drug, that's not for you. You have to stay on these drugs for years. So the best drug is the one that you can live with. There are antidepressants used because, as I told you, you have the manic and the depression side. About the other side of treatment of bipolar is treating depression. Now, you can have the manic period, where drugs like lithium and the anti-seizure drugs like Depakote, Lamictal, Topamax, and Zonogram can stop the manic, and they can have effects on depression, but I would say not as powerful effect or not as therapeutic effect as pure antidepressants. The atypical antipsychotics treat the manic and may minimize the depression, in some cases treat it completely, but you may require 2 drugs because the illness has 2 parts, both manic and depression. So you may have to treat with antidepressants. Now, there are different types of antidepressants. There are 7 classes of antidepressants, which I think I need to run through for completeness, and because every individual may benefit from one of them. The most common class, and the class that everyone hears about, are the selective serotonin reuptake inhibitors. They are all in a group because they affect neurotonic. What are these drugs? The common one would be Prozac. I would say the next one would be Zoloft, Paxil, Celexa, Lexapro, Luvox. I think I've got them all there. These are all used because they're safe, they don't have risks in overdose, their side effects are minimal. They help the mood, they can be given once a day. Here's the problem. They may interfere with sexual drive, and in women cause problems with orgasm and decrease in sexual drive. In men, they may have problems with ejaculation, problems with sexual drive, problems with erection. That's the most common problem I have with my patients. They come and say, yeah, doc, this works. I feel fine. My mood is stabilized. I'm not depressed, but I have no sexuality. That's a problem. They work great. They're safe. They're tolerated very well. There is minimal drowsiness, minimal weight gain. The withdrawal syndrome, maybe Paxil would be the worst for this withdrawal syndrome. But otherwise, they're easy to come on and off of. They're not dangerous drugs. They don't have a lot of dangerous interactions. Prozac may have some interactions with some drugs like tricyclics, which concerns me. But by and large, their drug interactions are not that severe. But the sexual problems are a big problem. So my patients come in, and I say, well, I understand that. And they come and say, I don't want to gain weight, I don't want to be drowsy, and I don't want to have sexual problems. Doctor, what drug should I take? And I'm still depressed. So then I will come up with Wellbutrin. It goes by different names: Wellbutrin, bupropion, Zyban, Aplenzin are all names for the same chemical, bupropion. I like the slow release form of this drug the best. What's the beauty of bupropion, Wellbutrin, Zyban, Aplenzin? Well, you don't have decreased sexual drive. You have no sexual dysfunction. There's no drowsiness. There's no weight gain. It can help with concentration. That all sounds great, and it's my favorite drug if you can tolerate it. But some people may get irritable, headaches, have trouble sleeping, sweaty, and they become aggressive on it. So it's a trade-off. It's not the best drug for everyone. So as you're listening to this lecture, don't think you're going to stop the drug you're on. Sometimes the drug that works is the best drug. But that is another class, and it's something to think about. There are other drugs. If you failed the Prozac, Paxil, Zoloft class, which is SSRIs, or the Wellbutrin class, well, there are other drugs out there like Cymbalta, Pristiq, and Effexor, which are in the SSNRI class, which is another good option. These drugs may help with anxiety, help with depression, are very effective. If I have to say any class that works better, this would be it. They also have the sexual dysfunction, but they're very effective and they're very easily tolerated. Usually dizziness, lightheadedness, drowsiness, dry mouth, vivid dreams. They do have a severe withdrawal syndrome, which could be problematic, so you cannot stop them suddenly. But that class works well. There are some other groups. I would say Remeron is another class, mirtazapine. Works great for anxiety and depression, helps people sleep. You can gain a lot of weight with this drug. Some people that may be good. A lot of people it may not be good. Very good drug, minimal withdrawal syndrome, it works well. But the weight gain's a problem. There are some older drugs called nortriptyline, imipramine, desipramine. These are tricyclic antidepressants. They work very well. Problems: you can overdose and die with them. Dry mouth, blurred vision, constipation, drowsiness, forgetfulness, withdrawal syndromes. They treat headaches, they treat pain. They're good drugs, but they have their limitations. The next class would be monoamine oxidase inhibitors. This is the one when you read on the label on the medicine bottle, if you're taking antidepressants, don't take this cold medicine. These are these drugs. They require special diets. Parnate and Nardil require special diets and restrictions in things you can eat, and certain deadly drug interactions with meperidine. So they need to be watched. There's some St. John's wort. I don't think that has much value. We talked a little bit about the different types of antidepressants, and there being 7 classes. Another class, trazodone, Cerazone. This drug, I would say, is the least effective of the antidepressant classes. Cerazone may cause deadly liver problems. Trazodone may cause prolonged erections, but they can help people sleep. Other treatments for bipolar disorder could be ECT. That is where you stimulate the brain with electricity and cause it to have seizures. That may be effective in both depression and mania. A big question I get from people is, if you have all these great drugs and the treatment is so effective, why don't people take them? And why is there such a problem with compliance? And the answer I give, because people like being manic. They don't like when you take away their manic. They like the mood swings. They like the high or the irritability or the sense of inflated self-esteem or superpowers. So it can be difficult to keep these people on medicine, and they suffer the consequences of their medicine. And it usually takes an older individual in their 30s, early 40s before they realize, I need medication. For completeness, calcium channel blockers like verapamil and nifedipine may be used to treat bipolar disorder, not that well. Benzodiazepines like Klonopin, Ativan, and Xanax may help mood swings and mania and depression. I would not use them a lot. To sum up, the treatment of bipolar disorder in a patient involves prevention, living a low-stress life, eating the right foods, getting sunshine, exercising, seeing your therapist, having an action plan when you see yourself getting manic, having a therapist. So prevention, sleep has to be regulated, nutrition, diet, exercise, see your therapist, take your medication. And I would say it's helpful to develop a support, people who live with you who know when you're getting depressed or manic to tell you, hey, you need to do something. That would end the lecture on bipolar disorder.